Welcome to this explainer. We are diving straight into a diagnostic tool that is basically hiding in plain sight in clinics everywhere. Today, we're going to look at how musculoskeletal ultrasound acts as a dynamic, real-time detective for your joint pain. It's amazing because it reveals secrets about your body that traditional imaging can completely miss.
Let's kick things off with a pretty staggering number, $6.9 billion. That is the estimated national savings in the United States if we just appropriately substituted ultrasound for MRIs. I mean, it's a massive figure, right? It really begs the question, why aren't we using sound waves more often when dealing with orthopedic issues?
Well, to understand that potential savings, we just have to compare the two standard approaches. Traditional MRIs are incredibly powerful, absolutely, but they trap you in this tight, claustrophobic tube for about 45 minutes. Plus, they're completely off the table if you have certain pacemakers or metallic implants. Now, compare that to MSK Ultrasound. It's a fast, 5-minute focal exam, it's highly portable, patients tolerate it really well, and here is the absolute game changer. It allows for dynamic movement during the scan. We're going to get into why that's so huge in just a second.
But first, to really grasp how this technology works, we need to understand the language of sound waves. So let's look at echogenicity basics.
It really comes down to a simple grayscale spectrum. When sound waves hit dense tissue, like bone cortex, the sound bounces entirely back to the probe. It appears bright white on the screen, which we call hyperechoic. On the flip side, fluid actually absorbs sound waves, so it creates this pitch black and echoic void. Basically, everything inside human anatomy falls somewhere on the spectrum between bright white and pitch black.
Okay, so how does this actually look in practice? Let's move on to healthy versus torn tendons, or what I like to call the angel hair pasta. Visualizing anatomy with sound waves definitely takes a trained eye, but Dr. Jin Kiramura has this brilliant analogy. He points out that the thin, tightly packed fibers of a healthy, hyperechoic tendon look exactly like a bundle of dry angel hair pasta. Think about it. When the tendon is healthy, those bright, fibrillar lines run perfectly parallel, just like an unbroken bundle of dry pasta. But what happens when that tendon tears? Well, those tight fibers retract. They snap back like a broken rubber band. And when they do, they leave behind a void, a potential space. That space instantly fills with fluid. And because we know fluid absorbs sound, it shows up as this highly obvious, pitch-black anechoic pool right in the middle of all those bright white fibers. To a trained eye, a tear is literally right there in black and white.
Spotting a static tear is great, but let's talk about this tool's actual superpower. We're looking at the dynamic advantage of seeing in real time.
So, here's a crucial question for you. What if your joint only hurts when it moves? Let's say your shoulder or your ankle only gives you that sharp pain when it's in one specific, awkward position. If you're lying perfectly still inside a static MRI for 45 minutes, that scan might completely miss the problem. It's just taking a snapshot of you at rest, when everything might actually look perfectly normal.
This is exactly where MSK Ultrasound becomes an absolute game changer. It is entirely dynamic. Let's take snapping hip syndrome, for example, where the iliopsoas tendon literally snaps against the pelvic bone, or peroneal tendon subluxation in the ankle, where your tendons slide abnormally out of their groove when you rotate your foot. Even the ulnar nerve in your elbow can subluxate, basically snapping forward when you bend your arm. With ultrasound, the doctor just places the probe, asks you to reproduce the painful movement, and they can literally watch the tendon slip, snap, and pop live on the screen. The diagnosis happens right there in real time.
And beyond tracking movement, ultrasound has another incredible trick up its sleeve. Let's look at spotting foreign bodies. Because materials like wood, glass, or surgical clips are intensely reflective to sound waves, ultrasound makes them light up like a beacon. If you're looking at a scan and see this intensely bright, hyperechoic line buried in normal soft tissue, that's not bone, that is a foreign body. This kind of extreme sensitivity means a doctor can precisely target and remove tiny fragments. We're talking microscopic wooden splinters here. There's no guessing, no digging blindly into the tissue. It is honestly amazing to see a tiny splinter targeted and pulled out so precisely just by using sound waves.
Of course, no tool is perfect, right? We have to talk about the limitations, which mostly come down to the operator factor. Despite all these diagnostic superpowers, the technology definitely has its pitfalls, mainly because it relies so heavily on the human holding the probe. This brings us to a concept called anisotropy. If the operator holds the probe at the wrong angle, so the beam isn't perfectly perpendicular to the underlying tendon, the sound waves actually scatter away instead of bouncing straight back. What happens then? A perfectly healthy tendon artificially turns dark on the screen.
It creates the illusion of an anechoic, fluid-filled tear where there absolutely isn't one. It's literally a false tear, created just by bad physical technique.
And the human element isn't the only limitation. Because sound waves bounce off hard surfaces, they really struggle to penetrate deep bone. That means we get very poor visualization of deep intra-articular structures, like the labrum or deep joint cartilage. So, if you need a comprehensive look inside a deep joint, MRIs are still absolutely necessary. Sound waves also struggle to penetrate thick subcutaneous soft tissue, which can make exams harder depending on a patient's body type. And finally, because of its dynamic nature, ultrasound requires active patient cooperation. If someone can't follow the movement instructions, well, that dynamic edge is completely lost.
But when the conditions are right, we get to what is probably the coolest part of this explainer, the ultimate combo, diagnosis and treatment combined.
This is where ultrasound truly shines, its ability to transition seamlessly from a diagnostic scan to an immediate treatment. Let's look at calcific tendinopathy. It is a horribly painful condition where calcium basically builds up right inside a tendon. Guided entirely by sound waves, a doctor can locate that bright hyperechoic deposit, precisely guide an 18-gauge needle into the shoulder in real time, and literally frack the calcification. They forcefully flush lidocaine and saline into it and then aspirate or suck that chunky calcium right out into the syringe. They diagnose it, target it, and extract it all in one sitting.
So, as this explainer highlights, we're looking at a revolutionary shift in how we treat the human body. Between the massive cost savings, the real-time dynamic feedback, and the ability to combine a diagnosis with immediate relief, it really leaves us with one big question. Next time you have joint pain, are you going to ask for a 45-minute magnet or a 5-minute sound wave? Thanks for joining me today, and keep exploring.